A reported 65% of adults aged 45 or older who have been diagnosed with drug or alcohol abuse have reported feeling lonely. There are several reasons why a person suffering from substance abuse might feel isolated, including strong emotions of fear, shame, and guilt that are all perpetuated by the strong stigma around substance abuse and mental health in general. This can cause individuals to isolate themselves to avoid being judged by their loved ones, preventing them from getting the help they can need. But there are ways to support others, so here's some methods to employ in order to reduce the stigma in your community. Another thing you can do is use the whole person mindset. How would you feel if you were known by your worst mistakes, your lowest moments, or your most difficult struggles? If you know someone who struggles with addiction, it's important to recognize them as a whole person and not define them by their addiction. Shifting your mindset to focus on characteristics, interests, and personal connections can create a deeper level of understanding, allowing you to have meaningful conversations with the person, rather than knowing them based on their struggles. Again, it's important to know that people with substance abuse issues don't choose to be addicted. They have families, interests, and passions in life. Secondly, you can work on educating yourself and others. A lot of misconceptions regarding addiction are perpetuated by individuals who aren't fully educated about addiction. Substance abuse disorder should be seen as a chronic, treatable medical condition, and there should be a level of empathy for those who do struggle with SUD. One thing you can do is avoid stigmatizing language. Avoiding language that targets people with substance abuse disorder can help prevent equating people with their condition and can remove some of the negative connotations around addiction in general. Basically, try to avoid using phrases like junkies or addicts because it defines people by their struggles and removes individuality. Here are the basic steps that you can take to help educate yourself and others. First, do research. This is arguably the most important step because it's the foundation for the future steps, and it helps make sure that you have the most reliable and up-to-date information. I personally would recommend using sources like the National Institute of Health or addiction centers that specialize in these kinds of things because it helps you stay informed with the most reliable information. Secondly, call out misinformation. If you call out misinformation as it happens, it helps stop the spread of misinformation, obviously, and it helps show support to those around you who might be suffering. And third is educating others. This really varies from person to person. It can be as simple as avoiding stigmatizing language, or you can explain the science behind addiction and use personal anecdotes. It really depends on what situation you're in and how safe it is to educate other people around you. Lastly, you can advocate for change in your community. There are many ways you can advocate, mainly by showing active support for policies that focus on rehabilitation rather than incarceration, being a supportive ally to the people around you who might be struggling, and by promoting organizations that are working to reduce the stigma. As a final note, whether big or small, anything done to create a more connected and supportive community can help everyone thrive and can help prevent the loneliness we've seen in the past.